Fantastic. We have Dr. Clara Day. Welcome back, Dr. Day.
Thank you, Paulette. My name's Clara Day. I'm a kidney doctor at the QE, but I've been doing quite a lot of work on the vaccine project over the last few months.
And we've got Dr. Ingham, Peter Ingham. Can you introduce yourself, please, Peter?
Yes, thanks, Councillor Hampton. Good evening, everybody. I'm Peter Ingham. I've been a GP in Sutton Coldfield for 30 years now. I've just stepped down as chair of the Birmingham Solihull CCG. I'm working at UHB, or University Hospital, alongside Dr. Day, and I've been working in the COVID vaccination programme with her as well.
Fantastic. And I'm hoping he's here, Dr. Justin Varney.
I am Dr. Hamilton. Councillor Hamilton.
You can give me the name, Doctor. Love to be promoted.
I feel we taught you so much in the last year of COVID. I'm Dr. Justin Varney. I'm the Director of Public Health.
Right.
City Council.
Fantastic. And now the people that make tonight run smoothly. Can I introduce Gemma, who will be fielding the questions? Gemma, can you introduce yourself, please?
Of course.
I'll call her my side, by the way.
Good evening, everyone. Gemma Rower, Assistant Director of Communications for Birmingham and Solihull Clinical Commissioning Group. Just to remind everyone of some housekeeping rules, if we could please keep our video and mics off, please, that would be very helpful. We also have two sign language interpreters, Rachel Veazey and Sarah.
Gemma, you killed my glory. I was going to introduce them.
Oh, apologies.
Young lady.
Apologies.
Okay, let's do the go on, finish what you were saying.
I was just going to say, if people need an interpreter, please pin Rachel or Sarah to your screen and they will change throughout the meeting and they will explain when they're going to change over.
Fantastic. And could I just introduce Kulvinder Nagar? Without Kulvinder, this would not have happened. This young lady has really organized a lot of this beforehand. So Kulvinder, could you just come and say good evening, please? Kulvinder, where are you?
Yeah, I've just come on screen. Hi, my name's Kulvinder Nagar. I'm the Comms and Engagement Lead for the Public Health team, working on Test and Trace with Dr. Justin Varney. It's nice to meet you all.
Thank you, fantastic. Now we'll get started. Justin, unless I've missed anybody, I haven't. You know what it would be nice to do before we get started? Sarah and Rachel, could you just come on camera, please, so people can see who you are? They are the language, speech and language interpreters. Sarah, if we start with you, and then Rachel. Sarah?
Yep, we've said hello. Yeah.
Right, and Rachel, so people know who you are. Rachel?
Rachel has introduced.
Yeah, I've said hello.
Yeah.
Oh, she has, because I didn't hear anything. Okay, we'll move swiftly on. Justin, it's over to you to do the introductions and just some slides about what we are talking about, the subject matter about COVID-19 vaccinations. Thank you, Justin. Over to you.
Great, thank you. And I think Gemma's shared my slides for me. So I'm going to talk a little bit about coronavirus and the tests and then the vaccine. And that's because we all start at different stages in our understanding. So this way, everyone is on the same page when we have the conversations tonight. So coronavirus was first identified back in December 2019. The main symptoms you get if you catch COVID are a high temperature, a dry, persistent cough, or the loss of taste or smell. Now, people do get other symptoms, but these three are the most common ones, and people usually have at least one of these, but they may have other symptoms as well. Now, although most people who develop symptoms recover without needing hospital, about 15% become very ill and need oxygen, and about 5% become critically ill and end up in intensive care. And those proportions haven't really changed through the pandemic. coronavirus is spread through droplets of saliva that come out of our mouth or out of our nose, and they get into our bodies by those droplets landing on something and us touching them, landing directly on our face. And if we touch something with the droplets and then touch our face, the virus crawls into our mouth, up our nose, or into our eyes. It can't burrow through our skin. It has to be spread and get close to our face to be able to get into our body. So we stop the spread of the virus by washing our hands frequently, keeping the physical distance, wearing the face covering so that our droplets stay close to our face, and being in well-ventilated spaces, which helps disrupt the spread of the droplets. We can move on to the next slide, please, Gemma. So this graph just shows you a bit of the journey we've been on with coronavirus over the last couple of months, and the effect of the national lockdown, which has really reduced the case rates. But we still are seeing cases every day and every week, and we are still seeing people going into hospital with coronavirus, and sadly, people are still dying. If we can move on, please, Gemma. And when we look at the spread of the virus amongst different communities, we do see slightly higher rates in some communities, particularly in our Asian communities. But we're seeing the case rates coming down in all communities. If we move on to the next slide, please. And we do see differences in case rates across different parts of the city. At the moment, the case rate is high in Soho and the Jewellery Quarter, but that's because we have an outbreak at the prison. But in many other areas, we're seeing most of the spread being in people's private homes and in workplaces. If we move on, please, Gemma. So we test for the virus in two different ways. We test through what's called a PCR test, where we use a swab to the nose and the throat, and that goes off to the laboratory to find very small amounts of the virus. That takes usually a day or so to get a result because it requires lab work, but it's very good at finding very small amounts of the virus. And we use it to test people who have symptoms to make sure that those symptoms are caused by COVID. People book those tests by ringing 119. The other type of test is the lateral flow test. Same swab to the back of the nose, back of the throat, but instead of going to the lab, it's used with the test kit there and then, and it gives a result within 30 minutes. The lateral flow test is looking to find bits of the virus, so it needs a lot of virus on the swab to be able to find it. And that's why the lateral flow kit is most effective at finding people who are actively infectious and have lots of virus in their throat and nose. And we use that to routinely test people who don't have any symptoms, but might be infected and might be spreading the virus. And there's information on the council website about the sites across the city where you can get a lateral flow test for free. If we go on to the next slide. So now I'm going to talk more specifically about vaccines. Our bodies have many ways we defend ourselves. Our most important defense is our skin and our stomach, but we also have a general immune defense which attacks anything that foreign comes into our body. But we also have special defense where we've seen something before and we've learnt to respond with antibodies to defend ourselves. And vaccination works by teaching us to develop that special response, the antibody response. Vaccination has been around for hundreds of years, and vaccines are medicines that teach our body to develop antibody responses by exposing us to usually small bits of the organism that causes the disease sorry, without infecting us. Antibodies, our body's defense mechanism, recognize organisms, so the things that cause diseases, usually by the way they look and what the outside of them looks like. We often call that the outer coat, and the things on the surface of that coat, which are a bit like buttons, are called protein spikes. And that's what our body recognizes. And if it sees an organism that has the right buttons on it, the right protein spike, then it attacks it. We develop vaccines in different ways. Some use a dead virus, some use a bit of the virus, that button, and they attach it to a harmless virus. Some just use the buttons on their own, and some use like a recipe card that teaches our body how to make the buttons so that we then know what they look like and can attack them. But it doesn't teach us to make the whole virus. If we move on to the next slide. All vaccines go through the same process to check that they are safe and effective. And that involves trials in the laboratory and then stages of trials with people. First, to check that the vaccine does what we think it does in people and is safe, and there are no serious reactions. And then also to test that it does it in different types of people, so different ages and different ethnicities at much larger scale. And also to monitor how the vaccine works over time as well. So those are the 3 stages of the trials. And when those trials are completed, all of the data from those trials is given to the regulator, who's independent, and they look at it all and they say, yes, the vaccine works, or no, it doesn't. And if they say yes, then vaccine production starts and a vaccine can be rolled out. Now, in normal times, all of that takes a lot of money. It takes a lot of people needing to be recruited to come and do a research trial. And it takes a lot of committees that only meet perhaps once or twice a year. So you have to wait for your turn to be able to get permission to move on. Now, in COVID, everyone around the world agreed this was really important. So they made sure there was plenty of money. When the researchers went out and said, would you like to join a vaccine trial? People queued up to join it. And we also did trials in different parts of the world at the same time because COVID was all over the world, which is something we wouldn't be able to do with flu, for example. And finally, when they needed the approval committees to meet, rather than being told, I'm sorry, you've got to wait 3 months till we meet, they were told, yes, of course, and they brought everyone together next week. So that all made things move much faster than they would in normal times. But every single step of the process was followed. They didn't skip any bits. It's just that actually the world agreed to make this move faster and make sure that some of the things that would normally slow us down, that would be red lights and roadblocks, got removed. If we move on to the next slide, please. There are different types of vaccine. The Pfizer vaccine and the Moderna...
I'm ever so sorry to stop you, but we're getting things in the signpost to say that people can't hear you. So if I could ask you to just throw your voice a little bit more so people can hear what you're saying. I'm not sure why that is. It's not clear to me. Okay.
Yes, it may be the headset, so I'll remove it, which may make it a bit better.
Okay, thank you, Justin.
At that pause there, we're just going to swap interpreter as well, if that's okay.
And while we're pausing, if anybody has any questions, can I please ask you to put it into the chat box? If you want to ask the questions directly, please put your hand up, which is in the participations box, please. Thanks. Justin, back over to you. Sorry about that.
Thank you. So there are different types of vaccine. The Pfizer vaccine and the Moderna vaccine work in a similar way. They give our bodies the recipe card to create those buttons, the protein spikes. And it's a one-time only recipe card, so our body forgets how to make them after it's done the manufacturing. The AstraZeneca vaccine works in a slightly different way in that the recipe card is taken into our bodies, attached to a harmless cold virus that gives monkeys the cold, but doesn't do anything for humans. And again, it's a one-time use instruction sheet. The recipe card goes into the cells of our body, but it doesn't get involved in our DNA. The way that it works is that in our cells, we've got bits of our cells that are like little factories, and they produce protein and they produce the things that cells need to function. And then there's like head office, which is where our DNA sits. And we all know people in head office don't come out very often. And that's just the same in the cells. So the recipe card goes to the factory and head office don't even know it's going on. And that's why it doesn't have any impact on our DNA. So when the factory in the cells produce the protein spikes the buttons, our body sees them and creates antibodies and can respond. And we've learnt then, it's a bit like sitting an exam. When you have the first dose, it's a bit like your GCSEs. You learn it reasonably well. When you have the second dose, it's like your A levels and you really learn it effectively. And that's why we give the 2 doses, and you need both doses to really get the full protection. But after the first dose, you see a big reduction in the risk of dying. And that's why it's so important people do take this vaccine quickly. The effect of the vaccine takes a little while to kick in. And that's because our body is learning to make these antibodies. So you don't get the full protection until 2 to 3 weeks after the doses have been completed. And none of the vaccine products contain any animal or any fetal products. So that's parts of babies, for example. None of those are included in the vaccines. We can move on to the next slide, please, Gemma. Thank you. Like any injection, there are some side effects. So most people will get a bit of a sore arm where the injection goes in, and a bit like the flu jab, the day or two after, people often feel a little bit headachy, a bit tired, they may have a sore arm, but all of those go away after a day or two. And if you have those bad feelings, you can take paracetamol if you're not allergic to it to help. As with other medications, if you've had a serious allergic reaction to a medicine in the past, you should tell the healthcare professional before you have the vaccine. For the Pfizer vaccine, there are some contraindications, so reasons to not give it to people who've had serious allergic reactions to medicines before. But the AstraZeneca vaccine contains different products and is safer for people who've had serious allergic reactions to medicines before. If you're pregnant, we think you still can have the vaccine safely, but because we're generally more careful about giving new medicines to pregnant women, we're taking our time in terms of rolling this out to pregnant women. But if you are in the vulnerable group and you're eligible to have vaccine, you should discuss this with your midwife or your medical team. We go on to the next slide, thank you. I wanted to touch just briefly on new variants. So as I said, viruses, when they get into our body, they use the factories in our cells to make baby viruses. And when they're using those factories, there are factories, not their factories. So it produces little changes, and those are the mutations in the virus. Most of the time, these don't make any difference at all. But occasionally, we see a mutation which makes the virus more infectious or more dangerous, or has an impact that reduces the effect of the vaccine. Currently, there are variants of concern in South Africa, the UK, Brazil, and Japan. When we see a new variant, we do research studies to look at, does it change the effectiveness of the vaccine? So far, these studies have shown that the vaccines that we have all still work, particularly at reducing the risk of becoming seriously unwell if you catch COVID. And they still reduce your risk of catching COVID, but perhaps not quite as well as they did against the old version. Now we've developed vaccines for COVID, it is much faster if we need to develop a booster injection to give extra lessons to teach our body to respond to new variants later in the year. But at the moment, it's really important to take the vaccines we have now because we know they protect against all of the major strains of virus in the country at the moment. We move on to the next slide. So finally, I just included in the slides some of the data from some of the wards in Central Birmingham, so that you can see how uptake is going in different priority groups. Obviously, people who are over 65 and now people who are over 60 have only just been invited to have a vaccine, so the uptake in these groups is lower. But we do see in some areas, like Balsall Heath West and North Edgbaston, for example, uptake is lower than it is in areas like Harborne and Quinton. We move on to the next one, please, Gemma. Again, if we look at Ladywood as an area, as a constituency, uptake in general is lower in many of these parts of the city, like Bawdsley and Highgate, or Nechells and Newtown. And that's why we're doing sessions like this, so that we can help people understand the vaccine better, so they can make an informed decision rather than listen to what they see in WhatsApp groups or on Facebooks. And they have the opportunity to ask the experts in the group tonight the questions from some of the medical experts like Clara and the GPs on the call. The final slide, please, Gemma. And finally, I included the data on Hall Green. Central Birmingham is quite a broad area, so I've included a couple more slides than I would in some of the other areas. And I think the slides will be available after for you. They're also available on the CMIS website for the council, and we update this data for the public every month and discuss it at the local outbreak engagement board. I know from when we started doing these sessions to when I last updated this data about a week later, we saw a real improvement. When we first looked at this data on the 16th of February, we still had many wards where there were only 50% of people that had had the vaccine who were over 80. And now we have no wards with less than 60% uptake. It's still a long way to go to get to 90%, which is the level we need to see to really protect people. But we are on our way and we've made a really good start. So I'll end there, Councillor Hamilton, and hand over to you for questions.
Thank you so much, Justin. That really does help to set the scene. We're going to move swiftly on because we always run out of time for questions, and this is our last session for the time being. So I'm going to move over to Gemma. Gemma, have you got the first 3 questions for me?
Yes, I have, Paulette, thank you. So this is from David. David wants to know if he can still use lateral flow testing after he's had the vaccine.
Right, and that is a Justin question. Justin Varney, Dr. Varney, would you mind taking that question for me, please?
Of course.
Okay, and question number 2, please. Can we have them in batches of 4? Because we have 4 professionals on this line tonight.
Of course. So this is from G. They would like to know, due to the rush nature of the vaccine, how do we know it's safe in the long term?
Can I ask Dr. Clara Day to answer that, please?
This one's from David. David says, to increase the uptake of vaccine in younger members of the community, would we consider vaccinating in the workplace if the facilities were suitable?
Can I ask Dr. Oni to answer that question, please? And question number 4, Gemma?
This one's slightly controversial maybe, but I'll read out anyway. They've said, why has the government said that there is no recourse to sue if the vaccine is safe? This is rather than using famous BAME people to advertise the vaccine would increase uptake of the vaccine.
That is a little bit political. What I would say is, Dr. Ingham, I'm going to give you that question, but I just want you to explain the bit about why we need people to take the vaccine, the uptake of the vaccine, relating to the higher the uptake of the vaccine, the less likely we are to have variants, that side of things. But the bit about the government, that is very political. And I would ask that person on the line to direct their questions directly to government, please. Yeah, so can I start with Dr. Day, question 2, please?
Certainly. So I think, as Dr. Varney said during his slide presentation, that these vaccines have come through quite quickly, but of course we're desperate for them to come through quite quickly. And the reason for that is that an enormous amount of effort has been made worldwide to get these through, and that's by lots of money being put into this, but also people being keen to come into the trial, so recruiting quickly, and then for meetings and follow-up to be as quickly as possible, so that there's not quite so much time between trials in phases as there were before normally in trials. So normally you'd do one bit of a trial, then you'd look at it, you'd have to then agree the funding for the next bit of the trial, and then you'd do that bit of the trial and have a look at it, and then you'd have to agree the funding for that bit, and then the third bit. And so it's usually quite a long process because of financial constraints and because of people's time getting this through. But this has been such an important vaccine for the world to get back to normal, that some of those bits of red tape have been smoothed through so that the trials can be carried out as efficiently as possible. All the same regulation has been carried out through these, and as Dr. Varney says, the trials are carried out by the drug companies and then signed off by independent regulators, so not government, independent regulators, to check that the trial results are okay. So the same processes have been followed as for any vaccine. It's just that it's been quick because of the necessity to get us back to normal.
Thank you. Can I ask presenters if they can just slow it down a little bit because of the people trying to interpret what is being said? I'm not saying you were very fast, but I've just remembered I needed to say that anyway. Okay, so it's not about how you've done it, Clara. It's basically I needed to say it. So can I move swiftly on to Peter? Peter, Dr. Ingham, over to you.
Just swapped interpreters as well, just while you were doing that.
Thank you, Councillor Hamilton. Yes, it's difficult. I think the first part of this question is very political. The government has underwritten the vaccine programme, so I won't go further into that. And I think, Councillor Hamilton, you asked me to direct the question more towards the uptake of the vaccine and encouraging people to move towards taking the vaccine. It's absolutely clear that the more people that take up the vaccine, the better the population will be protected. And as more and more people become protected, it gets more difficult for the virus to then find somebody else to infect. So what we move towards is population immunity, herd immunity, which then gives us a degree of safety. There's a lot of unknowns about this. We don't know that people who've had COVID earlier are protected in the long term. We do feel that the vaccination will give longer term immunity. It may need topping up. We may need to do another vaccination later on, and that has been mooted and put forward that it might happen in October. But what we need to do is to encourage the population as a whole to embrace the vaccination, because that protects us all. The other thing to say is, if the population is protected, that means, or if you like, if there is less virus around in the community, then there will be less mutations, because spontaneous mutations happen, and they will happen more if there is a large viral load amount in the community. So we will reduce the mutations as we move forward by doing that. So it's in all of our interests to move towards population immunity. And I think it's part and parcel. I think it's something that all of us should embrace.
Thank you for that, Dr. Ingham. Dr. Oni, welcome to, this is your first session with us, but I have heard some of the podcasts that you've done and you are excellent. So can I ask you to answer the question that you were given, please?
Oh, thank you so much, Paulette, and thank you for such a wonderful
brilliant
introduction. So
Right.
yes, I was told to talk about alternative venues, more or less, especially for the younger population. And I have to say, it's something that we're already looking at. In fact, we had a paper that came out nationally yesterday that was talking about us starting to look at alternative venues. In Birmingham, we've actually started now to look at faith venues. So we are now looking to go into mosques. We've already stood up one mosque already, and we're looking to work closer with faith leaders and see if the population wants it. We will take it to their places of worship and vaccinate their congregation there. I don't think it's going to be very long before we start thinking of other alternative venues. So at the moment, we're not doing that. But with the mobile units that we have in Birmingham and Solihull, which is about 4 of them, I would think that maybe, I'm not sure, very soon we're going to have that. But at the moment, I have to say, there is a lot of availability out there. So we have the mass vaccination sites, we have your PCN hubs, which are some GP surgeries, we have some of, like I said, the mosque, and now with the mobile unit. So there are so many places you can go and get your vaccination done. But hopefully in the future, we'll even add more sites for you to get it done.
Thank you for that, Dr. Oni. And Dr. Varney, in this section, last but by no means least, about lateral flow, over to you.
Yeah, so the lateral flow is looking for bits of the virus, particularly the surface proteins of the virus, not for antibodies. So you're able to have a lateral flow test even if you've been vaccinated. And if you do develop symptoms, you should order a PCR test, because like any medicine, the vaccine is not 100% effective. And we do know people who caught coronavirus the day or two before they got their vaccine and then developed symptoms the day or two after their vaccine appointment. And that's not because of the vaccine, it's because they already had it. So you're still able to test either with PCR or lateral flow.
Thank you, Dr. Varney. Gemma, my sidekick, over to you. Can we have four more questions, please, Gemma?
Yeah, of course. So the first one is from A1. They would like to know how soon it's safe to take the second vaccine after taking the first one, please.
And that will be Dr. Ingham about safety.
Another slightly controversial one from G. They want to know why have companies that make the vaccine being given zero liability if there are any issues. I'm not sure we can answer that one.
No, G, that I'm ever so sorry, but the doctors are not here for those types of questions. So I'm not going to even field it, to be honest. What I would suggest you do is write to the government who made that decision in the first place. So can we move to question 3, please?
Yeah, so it's a question and a comment. Janice says it's quite clear that one of the issues is the NHS leave individuals at home until they are unable to breathe before providing any attention. She feels that at that point of attending hospital, oxygen levels are low and they're struggling to breathe. Any comments we've got on that? And also she's concerned about how quickly the vaccine's been developed and the long-term data around that as well.
Right. Can I split that into 2? The first part of that question relating, go back again, the first part of that question that we're absolutely clear.
So it was around leaving individuals at home until it's too late, essentially. And then
right, stop there. That question is for Dr. Oni, okay? If you could give us some comments on that point. Now, the second part of the question, I want that for Dr. Day, okay?
So the second part is around the speed at which the vaccine's been developed and the lack of long-term data and any implications that might arise.
Yeah, great stuff. Can we just have one more question, please?
There's no more questions in the chat, Paulette.
Okay, so Justin, do you fancy having one of my questions? Why should I get vaccinated if I'm not in an at-risk group? That will be your question, okay? Number 4. Now, can I ask people that are on the call, please field the questions, because this is what the doctors are here for. Otherwise, we'll have an early night. Okay, right. Can I start with Dr. Ingham, please?
So, Councillor Hampton, this is a question about the spacing between the 2 doses of the vaccines and then the safety that follows that. So the Pfizer vaccine, this is intended to be given in 2 doses, 3 to 12 weeks apart. Originally, the Pfizer company suggested 3 weeks, and we have moved as a government policy to try and vaccinate more people across the country with the first vaccine. It was suggested, therefore, that we move out the second vaccine to 11 to 12 weeks. The AstraZeneca vaccine was intended to be vaccinated at a 4-week interval up to a 12-week interval. So we have moved across the country to vaccinate at the second dose interval at 11 to 12 weeks. We know from other vaccinations actually that the immune system response is often better if there is a bigger delay between the vaccinations. And so there is a considerable body of evidence suggesting that actually delaying the vaccine helps and assists the immune system. And there is evidence to support the government's policy suggesting that we should vaccinate more people and space the vaccines, and that we're not doing harm by delaying that second vaccine. I think that's probably all I can say there.
Yeah, I think that's a full answer. The second question is for Dr. Oni. You've already got your question, Dr. Oni.
Yes, I was asked to answer why we're leaving people at home until they were very short of breath before they went into hospital. Can I first of all just speak into that? Whoever it is that puts the question on the chat, I'm not sure your name. I can only apologize. I'm not quite sure what experience that you've had that has made you feel like that, because that has not been our intention at all. We've run quite a few programs to say that general practice is open. If you need help, your GP is there. And also we've had the ambulance service stand up as well. If you need help and you call them, they would actually come and assess you and decide where you need to go, whether you need to go to one of the, what we call the red sites, where people that have COVID are actually assessed and duly looked after and a decision made what needs to be done with them. But on top of that, in Birmingham or across the country, we've also stood up what we call pulse oximetry at home, where people are empowered to actually have the machine that checks their oxygen at home, and somebody is in touch with them every single day. So I'm not quite sure the experience that has led to this, but I can only say to you, we are there. If you need us, please, by all means, get in touch. Call 111, call your GP. We will try and get you the best help that you need.
And can I just back up what Dr. Oni is saying? I feel as if I've been on this treadmill for the last year with the doctors. Don't know if that's a good or a bad thing. But Dr. Barney will tell you, at the beginning of all of this, we had a great deal of fear within many of our groups, ethnic minority groups. And what they were doing, they didn't want to go to hospital. So they weren't calling the ambulance or their doctors till it was actually very late on, because they were nervous that they were going to be sent into hospital. So they hung on and hung on and hung on, and they didn't want to bother the doctor. But the doctors and the nurses and the health professionals have been saying for months and months and months, call us, let us decide, and we will tell you if you need to go to hospital or you need to stay at home. So for that patient, for that resident, I can tell you a personal example of somebody that is very close to me in my family. And unfortunately, she passed away because of fear and just not calling in the emergency services. So can I say to you, the advice I'm asking you to give to your neighbors, your friends, your family, if they don't feel well and they start to have difficulty with their breathing, don't wait until it gets so bad that the emergency services can't help. The earlier you tell us, the more we can do to support you. And as Dr. Oni said, I've known numbers of people that have had the oxygen tanks brought into the house where they've been able to monitor for themselves. And also, I've got it myself, I haven't got it to Anne, I've got this little oxygen machine that helps to measure your oxygen levels, and it's there, and it just helps you to just look out that if things are getting bad, you know early enough. So just to just add to what Dr. Oni said, because she gave an excellent answer, but this is just my personal experience from family members. And thank you for that, Dr. Oni. We'll move straight on to Dr. Day and your question. Thank you.
Thank you. So my question's about the longer term effects of the vaccine and people being concerned about that. And I can understand that. This is a vaccine that's come out very quickly, and although it's been through all the tests that a vaccine would, I can understand that people are concerned that this is still a very new vaccine that's come out. What we would say is that the vaccine has been tested in the same way that any other vaccine would be, and that people who are in trials at the moment continue to be followed up at the moment. So although the vaccine's been rolled out because we know that it works and that it's protecting people, the people who've had the vaccine are followed up for 6 months after that. And quite a few people now have been followed up for that period of time because these trials have now been going on for some time. And so the monitoring has occurred according to that. It would not be standard practice at all to be following people up for a very long time in vaccine trials anyway, because if you're going to have problems with vaccines, they tend to occur very early on. So I can understand that people are concerned about that, but this technology, the way that we're using the vaccine is has been tested in many people in different types of vaccines. It's just the different type of protein that we're putting in there to stimulate the immune response. So we don't have that long-term data. That's absolutely true because this is a new vaccine. But we are, it has come through the regulation in this country that is independent of the government and found to be safe.
Thank you for that, Dr. Day. Can I move straight on to Dr. Varney, please, and your question?
Yeah, so the question you gave me, Councillor Hamilton, was around why should you take the vaccine if you're not at risk? So at the moment, the only people who are offered the vaccine who do not have an increased risk of dying from COVID are people who work in health and social care in close contact with people who do have a very high risk of dying. So the reason then we're asking them to take the vaccine is to protect them, but also protect the people they work with. And that's no different from when we ask doctors and nurses to get vaccinated against TB or against measles to protect the patients we work with. So at the moment that they're the only group who aren't at risk, who are eligible to be vaccinated. When we have vaccinated all the priority 9 groups, then we will have a second wave of vaccine, which will go to people in younger age groups who are at lower risk of dying. And then we are vaccinating to prevent the spread of the virus rather than to prevent death as the main reason for having the vaccine. And so then it will be about taking the vaccine to protect the people who for medical reasons cannot be vaccinated and the people who are perhaps most vulnerable because they can't have a vaccine. So it's part of us protecting other people as well as protecting ourselves. If I can also just add to the question that was asked about the booster jab, which Peter had, but I think wasn't understood. The question was about, is it safe to have the booster after the second dose close together? At the moment, we don't have a booster jab, so we don't expect it's going to be around till the autumn. The 2 doses are of the same vaccine, not a different type of vaccine, and it is safe to have them.
Thank you for that, Dr. Varney, and thank you for that clarification. Can I, Gemma, I'm going to ask a few more of my own questions because I like them and I can. Right, the first question, can I have the vaccine if I've already had COVID-19? And that's for Dr. Day, please. Can I have the vaccine if I have already had COVID-19? The second question is for Dr. Varney. Will it affect my fertility? Will the vaccine affect my fertility? Dr. Ingham, can I ask you, why can't I choose which vaccine I get? And then last but not by no means least, I think in everything you've been doing, you've answered my last one, but I'm going to ask it again. But Dr. Oni, how can vaccines with less than 90% effectiveness, how have they been approved? That is actually a trick question. You got it? Less than 90%. Right, okay. So I'm going to start with Dr. Day. Dr. Day, your question, please.
Thank you, Councillor Hamilton. So you asked me, is it safe to have the vaccine after you've had COVID-19? Yeah. So the answer to that is yes, and we would recommend people to have the vaccine even if they have had COVID-19. The guidance at the moment is that you don't have the vaccine until 28 days or more after you've had the positive test. And the only reason for that is that what we don't want to do is confuse the illness of COVID-19 with any minor side effects that you might have with the vaccine itself. So it's not harmful to do that, but that's the recommendation. People say, well, why would I need the vaccine if I've already had the illness? Will that not give me protection? And the answer to that is that having had the infection probably does give you a little bit of protection, but having the vaccine gives you extra protection. And we know that if you've had it mildly, you might not get as good protection at all as if you've had the vaccine. And as Dr. Varney says, it's then important to have the 2 lots of the vaccine to challenge your immune system twice, once to stimulate it and the next one to remind it, so that if you do come back again and come into contact with the virus, that your immune system is completely primed and experienced to attack the COVID-19 virus and not make you unwell. So we would definitely recommend you to have it, even if you have had the virus itself.
Fantastic, Dr. Day, fantastic. Dr. Varney, the second, you know I like how you answer this question about fertility, because if I got £1 for every time I was asked this question by a youngster, I would be able to buy a bigger house. So, Dr. Varney, over to you.
So we know from the vaccines that we've used for many, many years that vaccines don't impact on fertility. And that's for several reasons. So the vaccine doesn't affect your DNA, and it doesn't go anywhere near your reproductive organs. So it can't affect your eggs or your sperm. And the instructions that the vaccine gives you to make the little protein spikes, the buttons, disappear. They're like in a spy movie when the instructions go up in flames. It's a bit like that. It's a one-time instruction. Then it's not that our body learns how to make these buttons forever, but what our body does learn is how to make the antibodies, the defense against them. So it doesn't mess up your DNA, doesn't have anything to do with head office, and it doesn't go near any of your reproductive organs. And that's why it has no impact on fertility. And no vaccines have ever been shown to impact on fertility, because vaccines are very different from medicines like penicillin or thalidomide. You know, they work in different ways. And the technology that we're using, like Dr. Day said, is an approach that we've used before. The virus is different, but the science isn't particularly different.
Excellent. Dr. Ingham, over to you. Why can't I choose which vaccine I get?
Thank you, Councillor Hamilton. So we want to protect our population as broadly and as quickly as we can. We believe that both of the vaccines are very effective at protecting the population. So in order to do that, because this is a nationally driven project and is organised nationally, there has not been the availability for patients to have a patient choice here about which vaccine. We don't have that opportunity or that luxury. We need to vaccinate, and vaccinate a lot of people with the vaccines that we have available, which we believe in. There are clinical instances where a choice of vaccine would come up, though. So, for instance, one of the vaccines has a chemical within it, polyethyl, what is it? PEG. But you don't need to know what it is, but it is a constituent to which some people rarely have an allergy. And in that instance, we would ask for the patient to be vaccinated with the AstraZeneca vaccine instead of the Pfizer. There are other instances where we might clinically choose, but on the whole, this is not about a patient choice. This is about vaccinating with trusted vaccines.
Peter and Dr. Ingham, can I ask you, that PEG, how does somebody know they're allergic to PEG? How would I know I'm allergic to this?
If they've had an allergic reaction to something that could possibly contain PEG in the past. Also, if they've had multiple allergic reactions, I mean serious allergic reactions to other drugs, or in fact, where they've had a very serious allergic reaction and we really don't know the reason why, then we might wonder whether that patient has a reaction to that constituent. At that point in time, what your GP should do, or the hospital should do, is refer you through so that your case is reviewed by an immunologist and a decision can be made to progress to vaccinate.
Brilliant. And thank you. Can I go straight over to Dr. Oni, please? And yours is about the 90%, if it's less than 90%.
Okay, Paulette. So to be honest, can I first say, I'm not an expert and I don't work for MHRA, so I don't license the vaccines, but I can only speak from my understanding of it. Now, we need to understand, like Justin says, what the vaccines actually do. They are not supposed to be 100% where they say if you get vaccinated, you will not get the virus. What the vaccines are going to do is if you get the virus, you will not suffer very serious consequences because your body has the immune system to be able to fight it. I know that the WHO has a cutoff where they say up to, I think it's 50%. I think Justin might be able to tell us a bit more about that, where they say beyond that, that vaccine is effective. And so any vaccine that is able to be above that threshold and be able to protect you from suffering serious consequences up to and including death, I would imagine is effective. And that is probably why the MHRA, who are the experts in this and have all the knowledge there is and have all the information they need, looked at the vaccines that have become available and say, yes, they are all effective.
Thank you. Justin, could you just add a little bit to that, please? Because I know there's a little bit about the effectiveness of both doses, e.g. it is over 90%, they reckon it's about 95%, but there is that difference between 95 and 100% chance of getting it. just that little bit to ensure that we have absolute clarity out there.
Sure. So as Dr. Oni said, if really we want a vaccine to be more than 50% effective, flu jabs are about 40 to 50% effective in terms of preventing you catching flu, but then very effective at stopping you dying from flu. The COVID jabs are more effective than the flu jab. And if we say 95% effective at stopping you catching the infection, that means only 5 people in 100 would catch COVID after having both doses. And we also know from the trials that even if those 5 people do catch COVID, they are very unlikely to die or end up in hospital, because we think their body does get some defense, but it's just not the full strength defense. And that's because it's very unusual for people to have a vaccine and learn nothing from it, from their body just to ignore the challenge. Our bodies do normally learn how to make some antibodies, but they may not remember it perfectly. And that's what happens in that 5% of people. It's not they don't learn any defense, we just don't think they have it strong enough, so there's still a risk that they could become infected. But that's no different from any other medicine. No medicine is perfect, but these are a lot better than we thought they would be, given what we know about vaccines.
Thank you, Dr. Varney. Gemma, I hope you haven't fallen asleep.
No.
Do the interpreters need to swap over before Gemma starts? Because I know we've had a number of new questions. Okay, Gemma? Okay, thank you. Over to you, Gemma.
So this one's more of a comment than a question. It says concerns in the Black community are not conspiracy theories, but reasonable concerns of side effects and long-term issues. There's clearly not enough data to know how safe this is. They say we have reasonable grounds to be very concerned. So more of a comment really there.
Yeah.
Okay, Rupinder.
Just to just round that off, Dr. Oni, would it be possible with any question I give you, that point, if you just want to refer to it within your question? Because I think it is a valid point, because a lot of people do think that. But Gemma?
Sure, yeah.
One.
Rupinder would like to know, she's concerned about her daughter who's at university and when she will be vaccinated. I'm assuming she's, student.
1 second. That would be a Dr. Day question, if you don't mind. Yeah?
Thank you. David would like to know if children will be eventually offered the vaccine.
Dr. Ingham. Number 3.
Brian would like to know how we intend to extend the vaccination programme to the elderly and disabled who are housebound.
Dr. Oni, could you answer? Actually, that's a Dr. Day question. To be honest, that is a Dr. Day question. But Dr. Oni, are you comfortable in answering that question? Dr. Oni?
She's got her thumb up, Councillor Hammond.
Yes, oh, right, sorry. Fantastic, Dr. Oni, fantastic. And question number 4?
They're not so much questions, but there are a few comments. I'm just going to move past those to find the next question. Amelia would like to know, if you have antibodies, why do you need a vaccine? I'm in a trial, and although they said antibodies only last a few months, nearly a year later, people still have antibodies.
Very good question, actually. Right, we'll start with that question, and then Dr. Oni, I'm warning you, you're going to be number 2 on this one. So Dr. Varney, could you answer that question first, please?
Yeah, so we know from the national trials and the international trials, looking at antibodies in people who've caught COVID, that the majority of people forget how to make them after about 3 to 4 months. And some people it will last longer, but generally after natural infection, your body forgets the lessons it's learned. Whereas when you have the vaccine, it's a much harder test and our body really remembers, especially if we have 2 jabs. So I often say the vaccine is a bit like sitting your GCSE and your A-level, and natural infections a bit like doing your 11 plus exams. So you probably don't remember anything you learnt from your 11 plus now, but if you did GCSE or O-level maths and you did A-level maths, you probably still remember a lot of it, even now if it was a long time ago. So natural immunity, we know, wears off, and it is generally not as good as vaccine immunity. Also, there's no side effects for people that do have some natural immunity if we give them the vaccine. It just strengthens their response.
Thank you for that, Dr. Varney. Dr. Oni, over to you. Thank you.
Okay, so first of all, I was asked to address the concerns within the Black community, not just being about conspiracy theories, but reasonable concerns about side effects and long-term issues, and the fact that there's not enough data to say how safe this is. I think we've kind of addressed a bit of it to start with. I think when it comes to the Black community, we're not just talking about conspiracy theories, we're also talking about the historical health inequalities and the fact that historically Black people have been experimented on, and that is where this concern for safety comes from. I have heard it time and time again where Black people have spoken to me and they've said, how are we sure that this is not yet another experiment on our ethnic people? Because this has happened so many times. And I have to say, from everything I've seen and from everything I've read, this does not seem to be one of those cases. Everything is transparent. This is one case where I would say for the government, they have been honest. Everything you need to know is on the government website. Who the participants were, what side effects they've had, anything that you need to know about. In fact, in Birmingham and Solihull, we have a dedicated COVID vaccine website where they put everything and answer your questions. So I have to say, this is not one of those times where this is an experiment on just Black people. No, I understand the history, I understand the hesitancy around it, but I can reassure you, this is not one of them. Then the other thing is, I was told to talk about was how are we extending the vaccination to the elderly and the housebound? Okay, we in terms of the housebound, we have a project with Birmingham Community Healthcare where we have nurses actually going to those homes and vaccinating people. And I know that we got almost everyone who wanted, at least within my own PCN in Highgate, we had vaccinated everyone. But recently, when they reclassified those that were extremely vulnerable, we had more. And I know that by this weekend, we are going out again, or the nurses are going out and vaccinating those people. And then the elderly, that is why we are having so many venues being set up. If you're unable to get to your GP surgery, you let your GP surgery know, and we will make, when they contact you, you explain to them what is going on. And we're more than happy to put your name down on the list and you will get vaccinated. But you have the mass vaccination sites, you have the PCN hubs, you now have the mobile units which are coming close to you, and you have the housebound list with the Birmingham Community Healthcare. So whichever way you have to get vaccinated, just let us know and we'll make it available to you.
Thank you for that, Oni. Fantastic. Can we move straight on to Dr. Day, please, and then Dr. Ingham straight after. Dr. Day, your question?
So I was asked about whether students were going to be vaccinated. So as we've talked about throughout this evening, we've been asked to vaccinate people in a priority order. And that's started with the people who we were most worried about catching COVID because it has the most severe effects on them. So we started with people who were in care homes and care home workers because we wanted to make sure that the care homes were protected because they've really suffered during this period of time. And then we've worked down in age bands. So we've done the over 80-year-olds, and at the same time as doing the over 80-year-olds, we did health and social care workers, because they are in contact with COVID a lot of the time. And again, we want to stop them from spreading it to people who they're looking after. And now we're going down in age bands. So then it's 70 to 75, etc., all the way down. And within those groups, there's some that aren't age bands, and they are people who have health conditions who make them particularly vulnerable. So the first group that we did those along with the 70-year-olds are the people who are in the shielding group. So the people who, I apologise for my dog, who've been in groups that are shielding and therefore particularly prone to infection. And we're now in a group of people who would normally get a flu jab as well. So people with diabetes or bad asthma or something like that. So we're working down the groups and trying to vaccinate the most at risk first. Once we get to people who are beneath 50, then that's people who are not so much at risk of catching the disease and dying, but are at risk of catching the disease and spreading it around, as Dr. Varney says. And then we will be offering vaccine to that group of people, but not yet. And students will fall, if they are over 18, will fall into that category. And wherever you live in the country, if the government tells us to get to that, to be vaccinating that group of people, people will be offered the vaccination. So if your daughter is away from, sorry, I've assumed it was a daughter because my daughter's a student, I apologise if it's not. But if your daughter is away from home, then she will be offered it wherever she is. If she comes home, then she can have it at home also.
Thank you for that, Dr. Day. Thorough explanation. Can we go straight over to Dr. Ingham, please?
Yes, Councillor Hampton. I think the question was regarding whether there are plans at present to vaccinate children. Yeah. Currently, there are no plans to vaccinate children. None of the trials were conducted on children as such. So this may follow that we do move into a vaccination programme to vaccinate children in the future, but there is nothing hard and fast about this at the present time. If we look at other immunisation campaigns, we moved from vaccinating adults in influenza, and we now vaccinate quite a lot of children with known health conditions. So that changed over time, and I suspect COVID vaccination might move in that direction, but there aren't any plans as yet.
Thank you for that, Dr. Ingham. I'm going to bring Gemma back in.
So Doug would like to know what else we can be doing apart from having the vaccination. So are there any advice that panel members...
That is Dr. Varney, because he keeps telling me as well. Vitamin D, vitamin D, keep well, keep healthy. Anyway, Doctor, that's the first question. Dr. Varney, that one will be yours. Right, second question.
But this is from Rupinder again. They would like to know if you've had a bad reaction to the flu jab, should you take the COVID vaccine?
That's Dr. Oni, please.
Gemma, can I jump in? There was one from someone who said, if my friend's changed her mind, can she book again if she said no first?
That's Dr. Day. Did you hear that, Dr. Day? Have we got one more?
Yeah, so this is from Evangeline. Is the vaccine available in Birmingham for people over 65 with underlying health concerns? I can answer that one. Yes, it is. My family submitted the request forms, and after 3 weeks, they have not been contacted.
Right, that's one for us to take back. Is she... I'm quite happy to take her details, or Gemma is brilliant at taking people's details and then finding out. So not sure what's happened there. Is there one more question, Gemma, that we can give to Dr. Ingham?
From Bob, actually.
Yeah.
I've had the first jab and was given a 12-week period until the second jab. Do you know if that time frame is being achieved, and if the 12-week delay till the second dose is not detrimental to the effectiveness of the vaccine?
That's a good one. Okay, can we go to Dr. Varney first, please?
Yes, so I'm glad you remember the vitamin D lesson. So yes, at the moment, really important, all of us take vitamin D regularly, because in general, because the weather's awful and we're in lockdown, we're not going out enough. Over-the-counter vitamin D is fine. Also, if you have darker skin, particularly if you're from the African and Caribbean community, or if for religious reasons you cover yourself up when you go out, it's important to take vitamin D regularly as well. But there are lots of other things that are really important at the moment. If you do have to leave home because you're in a care bubble or because you're going to work, it's really important you test every 3 to 4 days with the lateral flow kit. And from March, as schools reopen, children and the families of children will also be asked to test twice a week. And this is to stop the spread of the virus in schools. So it's really important to test regularly. The other thing it's really important to do is to take physical activity every day. Many of us have found lockdown really hard for our mental health. And we know that a short walk, just 10 minutes every day, is really good at improving our mental health. So please look after your mental health as well as your physical health and test regularly.
Thank you for that, Dr. Varney. Can I go straight over to Dr. Oni, please, for your question? Thank you.
Okay, so I was asked to answer if my friend has had a severe allergic reaction or an allergic reaction to the flu vaccination, should I have the COVID vaccination? I think what we need to first of all quantify is what type of reaction did your friend have? Because quite a lot of times when we have vaccines, when our bodies are making these antibodies that Justin's been telling us all about, you might feel a little bit under the weather. You might feel like you've got the flu, which usually gets better after a few days. And we say if you have something like a temperature, take some paracetamol. So if it is that type of reaction, can I reassure you and say, this is not a side effect per se. This is your body making antibodies and trying to protect itself. So all we would say is if that is happening, if that was what your friend had when she had the flu jab, please reassure her and advise her she should please carry on, have her COVID vaccination as normal. And if she gets any of this type of reaction, headache, temperature, feeling a bit under the weather, paracetamol should settle within a week. If it doesn't, please see your GP for an assessment. If you remember, Justin told us, sometimes people might have the COVID in their system and not realize it. And then they have the vaccine, they get unwell, and they say it's a bad reaction to that. That might have been what has happened. We don't know. So if you're not getting better after a week of simple painkillers, please contact your GP and we'll reassess you. Now, the main one you need to know about is if your friend had a very serious reaction to it, where they ended up in hospital, they couldn't breathe, and they've ended up being given what we call an EpiPen, which some people that have severe reactions are given just in case they have it and they can't breathe. If that was what happened to your friend, then please, can I suggest that yes, they will still have the vaccine, but we would consider giving them the AZ rather than the Pfizer. So it's a conversation they need to have with their GP. We want to hear those kind of concerns. If that is something that is worrying your friend, please, can she pick up the phone, speak to her GP, discuss these concerns. Her GP will be able to advise her appropriately, and then she can go ahead and then make a choice what vaccination she needs to have.
Thank you for that, Dr. Oni. Dr. Day, over to you.
Thank you. So I think my question was about if you changed your mind and you've already been offered the vaccine, can you go back and say you'd now like it? Now, I think this is really, really important, is that we have worked down these priority cohorts in a particular order, because that's the highest risk. But that does not mean that you have missed your turn if you didn't take the vaccine at that point. You are always welcome to come back and say, I didn't really want it at that point, but now I would, if you have been offered the vaccine. So I would say the first thing to do is to call your GP back and see if they've got space. but equally you can now book if you've already been offered, so you fit into one of the groups that's already been offered. You can also book directly on the National Booking Service, and Gemma has put the link in the chat for that. And then you can just book yourself an appointment either at Millennium Point or Aston Villa or one of the pharmacies that are delivering it. Or, as I say, you can call your GP back and they may well be able to offer you one at your surgery or a surgery nearby. But please don't feel that because you've said no, that you weren't quite ready the first time, that you will be turned down, because you really won't.
Thank you for that, Dr. Day. And Dr. Ingham, the last point from Bob.
Okay, thank you. So Bob's question was about the 12-week period. Are we able to vaccinate him at the 12-week period, and also the effectiveness of the vaccine given that gap? So we're working very hard, Bob, to work through and plan to make sure that second doses are delivered to patients or given to patients at that 12-week interval. The second doses are starting to come through in March. We're putting a lot of effort in working out and making sure that the vaccine is available to those locations who vaccinated in the first instance. Clearly, your second vaccine would need to be of the same type as you had previously, and that's what we need to work through and make sure that that is available to you at the GP surgery, at the sites, or in fact at the large vaccination sites. So a lot of effort is being put in to make that happen. That we will make that happen. We have to make that happen. We talked a little bit earlier about whether the gap between the two doses of the vaccine was in any way detrimental to its effectiveness, and I don't believe it makes any difference here. It should, in fact, there is some argument to say that a bigger gap than the prescribed either 3 or 4 weeks up to the 12 weeks is actually beneficial and gives the immune system a better opportunity to, what shall I say, pass the A levels, according to Justin. So it would give a better opportunity for the immune system to develop a better response. So I don't think there's anything detrimental about the 12-week gap.
Right, thank you for that. Gemma, I don't think we've got any further questions. So can I round things up now then, please? Gemma, do you want to say, this is our last session. You've been a great sparring partner. Is there anything you want to say before I go to the panel about anything?
I'd just like to say, please use the website. I put the link in the chat. It answers lots of questions, and hopefully will provide a useful source of information for everybody. And don't forget, even if you've had the vaccine, hands, face and space, it's really important. Thanks very much.
Thank you. Can I go over to Dr. Varney? Are there any closing words that you would like to say to the public that are out there?
So I'd say if you found this session really helpful, first of all, share it with your friends and your family. The reason we've done these sessions is to help get accurate information out, but also to answer questions, because many people have questions and that's absolutely okay. What we want to do is help you get the right answer. You can also sign up to become a COVID community champion, and I've put the link in the chat. We've got over 700 champions across Birmingham, and we meet with them every week doing sessions like this. And Dr. Oni and other GPs in the area join me and my team to answer your questions as well. So if you've enjoyed it, please sign up and become part of the solution in Birmingham to make sure people do get their questions answered and help them understand how to protect themselves and their family.
Thank you for that, Dr. Varney. Can I go straight over to Dr. Day, please? Are there any closing words that you'd like to say to the listening public?
Thank you, Councillor Hamilton. I mean, just to say, as everybody else does really, please, listen to information from experts and do ask questions to people if you are concerned. I'm a doctor, I work at the hospital. Everybody I know has had this vaccine. There is over 100,000 health and social care workers in this city who have taken this vaccine now. And that's a lot of people who've looked at the science and around this and said, do you know what? I want to do this to protect myself and to protect my patients. And so please, please take this vaccine if you can.
Thank you, Dr. Day. Fantastic. Dr. Oni, would you like to say some closing words? And can I say what an excellent job you've done for your first one?
Thank you so much. So first of all, can I just say, honestly, it's not compulsory. I understand the hang-ups and I understand the fears, but please, can I ask you, if you have any questions, we would prefer you made an informed choice. Get in touch with us. We want to answer your questions. We want to empower you to make the right choices. But I don't want you to go away from here feeling that anyone is putting pressure on you because we have something else to gain. That is not why we're doing this. Why we're doing this is to give you the right information so that you can go away and do what we've always done on the NHS, make an informed choice. I also understand that a lot of people have been in lockdown for a very long time, and hence they are very afraid to go anywhere very far to get their vaccines. Can I please encourage you, if you are in that position, can you get in touch with us or get in touch with your faith leaders? Like I said, we now have mobile vans that we can take to areas where people are struggling to get to the bigger centers, and we will bring the vaccine to you. We just want you to make the choice to protect your family, protect yourself, protect your community. Spread the message. Please don't spread the virus.
Excellent. Spread the message. Please don't spread the virus. I love it. Love it. Right, over to you. Where's Dr. Ingham? Dr. Ingham?
Yes, my colleagues have already said it all, really. I would encourage everybody to have the vaccine. I've talked to lots of GPs and worked with lots of GPs. I've heard nobody ever mention that they wouldn't have the vaccine. There is no misgivings within the medical profession that I work and circulate with. And I think, as Dr. Oney said, I think the government has been quite transparent. A lot of the data is all out there about this vaccine. I don't think there's anything hidden here. We just want to protect the population. We want to move back to a point where we can get our lives back and live them like we remember.
That is excellent. Can I just say, the mental health concerns within the city, within this region, within this nation has gone up tenfold. And I am with all of you on this. This is not compulsory. You don't have to have this. But if we want to get back to any sort of normality, please, I ask you, Gemma has put the information, read the website in the column, check it out. Any questions you've got, ask. Find out to show yourself approved. And then at least if you make the decision that you're not going to have it or you are going to have it, you've done it with the full force of the information behind you. And can I just say thank you all for coming, well, not coming, for logging in tonight, but can I just say also a big thank you to Sarah and Rachel, who have been doing the sign language interpreting. They've done a fantastic job. And once again to Kulvinda, who helped to set tonight up. And this is the last of the sessions. But if we see that there's a need, I am sure Gemma is giving me a funny face, but I'm sure she doesn't mean it. I am sure that we will set these up again. But for the time being, this is the last of these sessions. And I just want to thank you. And I personally, so much, it has been incredible. So to the panel, to the support people who have helped us to make tonight happen, but especially to those who have taken the time to log on, thank you and good night.